Today I am going to explain you about nephrotic syndrome. Okay, another important topic from pathology that is frequently asked in the entrance examination. Okay, INICET as well as NEET PG. Okay, I will make you clear on the every questions that can be asked, like image based question as well as the facts that is going to asked in the oncoming NEET PG examination. So watch the videos till end. Okay. So nephrotic syndrome is a group of sign as well as symptom. So that is nephrotic syndrome. So nephrotic syndrome means there is excessive loss of the protein. Okay, the protein amount is around greater than or equal to 3 gram per day. Okay, so 3 gram per day protein is lost every day. So this is a nephrotic syndrome, and since there is loss of protein, so what will happen? Massive protein urea. Okay, there will be excessive protein in the urine, that is excessive protein loss in the urine. So massive protein urea, so decrease in the protein in the blood lead to the increase in the hydrostatic pressure, so it will lead to the outgoing of the fluid from the blood vessel into the interstitial spaces, so lead to what? Edema. So that is edema is occurring in the nephrotic syndrome. Okay, so it is mostly peri-orbital edema. Okay, around the orbit of the eye it is mostly seen. Okay, now next there will be feature of hypercholesterolemia. Okay, so increase in the cholesterol in the blood. Okay, due to increase in the cholesterol, what will happen? There will be secretion of these lipid in the urine, so lipid urea. And if we see, okay, examine that urine in the microscope, we'll see the fatty cast. Okay, these are due to the lipid present in the urine. Okay, next there will be dilutional coagulopathy. Okay, so due to the decrease in the level of the protein in the blood, which is acting as a plasma protein and different coagulating proteins, so there will be coagulopathy. Okay, dilutional coagulopathy. Now what are the frequently asked questions, okay, in the previous examination? Like first is most common, okay, most common cause of nephrotic syndrome in the children. So in the children it is minimal change disease. Okay, so we will study detail about minimal change disease later. Next is the most common cause of nephrotic syndrome in the adult. Okay, it is focal segmental glomerulosclerosis. Okay, next is the most common cause of nephrotic syndrome in the elderly person. Okay, so it is membranous nephropathy. Okay, it is membranous nephropathy. Now first we are going to study about minimal change disease. Is minimal change disease lead to nephrotic syndrome? So this minimal change disease, okay, it comes under nephrotic syndrome. So it mainly affect the children of 2 to 6 year age. Okay, it mainly affect the children of 2 to 6 years of age. Okay, now it is also called nil deposit disease. Okay, it is also called nil deposit disease. Okay, and it is also called lipid nephrosis or podocytopathy. It is based upon the microscopic changes that is occurring in the glomerulus and the other parts. Okay, so these names it may confuse you, so you have to listen. And the minimal change disease usually asked part is morphology, and under morphology we have to know the microscopic feature. Okay, under different light microscope, electron microscope and immunofluorescence. Okay, so first is light microscope. So under light microscope you will see the glomerulus is normal. Okay, normal glomerulus. Since it is a minimal change disease, so there is very less change in the changes seen in glomerulus, so it will be normal glomeruli, as well as there is lipid deposition in the tubular cells, means this is due to lipid nephrosis. Okay, lipid deposition in the tubular cell, so that's why it is also known as lipid nephrosis. Okay, now on electron microscopy we will see the effacement of the food process of the podocyte. Okay, so effacement of the food process of the podocyte means normally your what capillary wall. Okay, and this capillary wall, okay, it is lined by these podocyte. Okay, it is lined by these podocyte, and normally these podocytes are present like this way, but due to effacement there is fusion of these podocyte with the capillary wall, and this will lead to decrease in the function. Okay, these podocyte, okay, they will become non-functional due to their fusion with the capillary wall. So this is known as effacement of the food process of the podocyte. And So one of the microscopic feature of this minimal change disease is effacement of the food process of the podocyte. And next, on the immunofluorescence, there will be no any deposition of the immunoglobulins or the complement seen. So that's why it is known as minimal change disease. Nil, minimal means very very less, so there is a nil deposit, so it is also known as nil deposit disease. Okay, we won't see any immunoglobulins as well as complements deposition under the immunofluorescence for this disease. Okay, now this minimal change disease is highly responsive to the steroid. Okay, if we use the steroid to the patient, there will be good response, okay, with the steroid. And this causes selective proteinuria. Okay, selectively the protein is lost. Okay, so this is all about the minimal change disease. So next will be the focal segmental glomerulosclerosis. Okay, focal segmental glomerulosclerosis. And this focal segmental glomerulosclerosis, what are the causes of the focal segmental glomerulosclerosis? Its primary cause is idiopathic. Okay, not known. Okay, now its secondary cause, what are the secondary causes of this focal segmental glomerulosclerosis? For that we have the mnemonics, that is HRS. Okay, HRS. H means it is HIV, hypertension, heroin abuse. HIV, hypertension, heroin abuse. And R stand for reflex nephropathy. Renal ablation surgery means there is removal of the kidney. Okay, nephrectomy. Next, for S, it is sickle cell anemia. So these are the causes. Now other causes of the focal segmental glomerulosclerosis include IgA nephropathy as well as obesity. So these are the causes of the focal segmental glomerulosclerosis. Now what are the morphology? Okay, under the light microscope, 50% of the glomeruli show the segmental sclerosis. Okay, now it is a focal means only some of the glomerulus is affected of a kidney. Okay, and it is telling that less than 50% of the glomeruli they show the segmental sclerosis. Okay, now some of the high yield points that we have to know to understand the microscopic feature. Okay, and some image based questions. First is focal. Okay, this focal means less than 50%. Okay, less than 50% of the glomeruli of the kidney is affected. And diffuse means greater than 50% of the glomeruli of a kidney is affected. Okay, so around all the glomerulus of a kidney is affected if there is diffuse form. If focal, very less number of glomerulus are affected. But segmental means only some portion of a glomerulus, single glomerulus, some part of a glomerulus is affected, that is known as segmental. And global means entire portion of a glomerulus is affected or sclerosed. Okay, so that is some terms. Under the light microscope, for the focal segmental glomerulosclerosis, you will see only less than 50% of the glomerulus they show the sclerosis. On the electron microscopy, you will see the effacement of the food process of the podocyte, means the podocyte become non-functional due to the fusion with the capillary wall. On the immunofluorescence, you will see the immunoglobulins IgG as well as complements like C3, they are deposited in the sclerotic areas. Okay, so on the immunofluorescence we will see IgG, C3 complements, they are deposited. So these are the feature upon the immunofluorescence. Now if you see the images of these focal segmental glomerulosclerosis, okay, you can see this normally segmental. Okay, so this segmental means only some part of glomerulus is affected here. So it is showing that some segment, this whole it is a glomerulus. Okay, this whole is a glomerulus and only some part of the glomerulus is sclerosed. Sclerosed means there is pinkish material, they are deposited in the glomerulus that make the glomerulus non-functional. Okay, and these are the sclerosed materials, so that's why it has written segmental. Okay, some part of a glomerulus is only affected here. Okay, and these are the normal. Okay, these are the normal renal tubules, you can see side by side. These are stained by the PAS stain, per iodic acid skip stain. So this image can be asked. So we have the next figure. Okay, this is also the figure of focal segmental glomerulosclerosis. This whole is a glomerulus, and this whole glomerulus only some part of the glomerulus is sclerosed. Okay, so this is on segmental sclerosis. Okay, and this is also the another figure. Okay, here also this is a glomerulus, and this glomerulus, only some part of the glomerulus is affected here, so it is segmental. And a kidney has many glomerulus, so about more than 50% if they are affected, that is known as diffuse. But here focal means only less than 50% of the glomerulus is affected. For a normal kidney biopsy, okay, this is the normal kidney biopsy. You can see this is a glomerulus. Okay, this is a glomerulus, and this is the glomerular basement membrane. This is the normal thickness of a glomerular basement membrane. Okay, and these are the capillaries that are arranged. Okay, lumen of the capillaries, they are open here. Okay, and they are lined by the flat endothelial cells. Okay, they are lined by the flat endothelial cells, and they have the round nucleus. Okay, here are the cells, these are the cells with round nucleus, these are the mesangial cells. Okay, these are the mesangial cells. So this is a biopsy of a normal kidney. Okay. This is also the biopsy of a normal kidney. Okay, in the normal kidney you can see this is the normal thickness of the glomerular basement membrane. These are the cells with round nucleus, these are the mesangial cells. Okay, these are the mesangial cells, and these are the endothelial cells. Okay, they are lining the capillaries. Okay, they are flat. These are the podocytes. Okay, and these are the arterioles that are present, okay, side by side to the glomerulus. So now the different variants of the focal segmental glomerulosclerosis. Okay, it can be one that we have discussed, that is a non-specified type of focal segmental glomerulosclerosis. Second is the glomerular tip variant. Glomerular tip variant means it only affect the tip of the glomerulus. Okay, and it has the best prognosis. So this can be asked. Okay, so the glomerular tip variant, it has the best prognosis. Next is perihilar variant. Okay, it affects the perihilar region. And cellular variant means there is increase in the cellularity, there will be proliferation of the mesangial cells. Okay, so there will be increased cellularity in the glomerulus. Now there is collapsing variant, its name is collapsing, so it has the worst prognosis, and it is seen in the HIV positive patients. Okay, these are important points. Now what are the genetic basis of the nephrotic syndrome? Okay, so this is very very important. Okay, nephrotic syndrome, genetic basis of nephrotic syndrome. So it is due to the mutation in the genes, nephrotic genes. Okay, NPHS1 and NPHS2 as well as alpha actinin 4 genes are affected. First is NPHS1 gene. Okay, it is located on chromosome number 19, and it encodes protein nephrin. Okay, and it causes congenital nephrotic syndrome of Finnish type. Okay, now next is NPHS2, that is located in chromosome number 1, and it encodes protein podocin, and it is responsible for the steroid resistance in the nephrotic syndrome. Okay, and it causes focal segmental glomerulosclerosis in the children. Okay, and this type of glomerulosclerosis is autosomal recessive type. Okay, alpha actinin 4, it causes the adult onset focal segmental glomerulosclerosis. It encodes protein podocin actin binding protein. Okay, now next variant we have membranous nephropathy. Okay, membranous nephropathy is another type of nephrotic syndrome. Okay, so this nephrotic syndrome, its causes, what are the causes for this membranous nephropathy? It can be due to the malignancy like the colon cancer. Okay, colon cancer, that is very very important. Okay, so this pancreas as well as lung cancer, they may lead to membranous nephropathy. Some infections like malaria, syphilis, hepatitis, schistosomiasis. Okay, so schistosomiasis is responsible for causing the bladder cancer. Okay, that we have to deal in the GIT pathology. And drugs, what are the drugs that may cause this membranous nephropathy? Like gold, penicillamine. Okay, now autoimmune disorder like SLE, systemic lupus erythematosus, they can also cause membranous nephropathy. Now renal vein thrombosis, this may also lead. Okay, now what are the pathogenesis? It might be immune complex mediated. Okay, due to the deposition of the immune complex in the glomerulus, and this phospholipase A2 defect may also lead to membranous nephropathy. Now what is the morphology of this membranous nephropathy? The morphology, in the light microscope there will be deposition of the immune complex in the glomerular basement membrane, so it will lead to the thickening of the glomerular basement membrane. Okay, you can see the thickness of the glomerular basement membrane. So this okay, in a normal kidney biopsy, it is, if we compare, it is more thicker. Okay, so there will be thickening of the glomerular basement membrane due to deposition of the immune complex. Now on the electron microscopy you will see the epithelial deposit as well as effacement of the food process of the podocyte. Now on the immunofluorescence you will see the granular deposit, and this granular deposit on the immunofluorescence is seen due to the immune complex. Immune complex, if they are deposited, they will show granular deposit. Okay, so in the figure you can see this is the diffuse thickening of the glomerular basement membrane. This is the granular, these appear granular. Okay, these appear granular. So diffuse thickening of the glomerular basement membrane. This is membranous nephropathy, means defect in the glomerular basement membrane. Okay, so if you do the silver staining, okay, initially we have done the pass stain. Okay, on the pass stain it appears like this way, but on the silver stain, if we see the membranous nephropathy, it will appear like this. Okay, there it will resemble dome as well as spike, so it is known as a spike dome appearance. Okay, spike dome appearance. Okay, so these are the proliferated, okay, basement membrane. These are the proliferated basement membrane, and these proliferated basement membrane, they will show spike dome appearance. Okay, see, you can see here, this is the basement membrane, and these are the proliferated part of the basement membrane, and these are the immune complex that are deposited. These are the immune complex that are deposited, so it will give the appearance of dome shape. Okay, dome shape, it will appear as a dome. So basement membrane proliferated like a spike. Okay, so this is appearance of membranous nephropathy on silver stain. Okay, now next nephrotic syndrome is membranoproliferative glomerulonephritis. Membranoproliferative glomerulonephritis, MPGN. Okay, it is also called as mesenteric-capillary glomerulonephritis. Okay, and it can be classified as two types. Okay, first, MPGN type 1 as well as MPGN type 2. Okay, MPGN type 1 and MPGN type 2. First, MPGN type 1 is immune complex mediated. There is deposition of the complement, immune complex mediated, and there is deposition of the complement. Okay, but this MPGN type 2, it is also called dense deposit disease because there is deposition of C3 complement, and it is also known as C3 glomerulopathy. It is also known as a dense deposit disease or C3 glomerulopathy. Okay, now we have to know the morphology. Okay, so on light microscope the appearance of this MPGN type 1 and type 2 is same. Okay, so on light microscopy there is immune complex deposited inside the basement membrane. Okay, so due to the deposition, this basement membrane will split into two layers. It will resemble like tram track appearance. Okay, now there will be enlarged or there will be increased in the cellularity of the glomerulus. Okay, and there will be endocapillary proliferation. That's why it is also known as mesenteric-capillary glomerulonephritis, and these proliferation of the capillaries will give an appearance of architecture. Okay, to the glomeruli, and it is seen in both the type MPGN type 1 and type 2, whereas the difference is in the electron microscopy as well as immunofluorescence. So first, in the electron microscopy, subendothelial deposits are seen in the case of MPGN type 1, whereas dense deposit of the C3 is seen in the MPGN type 2. Okay, on immunofluorescence there will be granular deposit because this is immune complex, so there will be immune granular deposit. Okay, but in the immunofluorescence there is C3 deposition, so it is due to the linear, it will appear like a linear or ribbon like pattern. Okay, it will appear linear or ribbon like pattern. Now some of the high points, MPGN is characterized by persistent hypocomplementemia. Okay, there will be persistent. Okay, the word persistent. Okay, there will be persistent hypocomplementemia because the complement they get deposited in the glomerular basement membrane. Okay, but in the post streptococcal glomerulonephritis there will be transient hypocomplementemia. So this is all about the nephrotic syndrome. Okay, if you have understood, if you like the video, please subscribe and share among your friends. Thanks.